Hi, my name's Melissa Hadley Barrett. I'm a nurse practitioner and a sexologist, and I'm here today to talk to you about intracavernosal injections. Basically, it's just a fancy word for a penile injection into the shaft of the anatomy. Yes, most men freak out when I tell them they're going to put an injection into that area. However, it's just a tiny pinprick with an amazing result. And just about everybody comes back and learns how to do it themselves and masters the task at home. So the first step is we need to get your equipment ready. Obviously, well, maybe not obviously, I don't have that specific anatomy of my own. So I've got this one for demonstration purposes. I've named him Jeffrey. As you can see, Jeffrey is not the size of a normal anatomy, so please don't be intimidated if yours doesn't look this size at home. But he is very great for demonstration purposes. The other things you need is a small vial of medication. Every bottle of medication is compounded specifically to your needs, so you do need to have a consult with a sexual health expert in order to get the dose right. You also need these needles. Now, these needles are what diabetics use to give themselves insulin. You don't need to be embarrassed about when you're disposing of them. People aren't going to know exactly what you're up to. We also need an auto-injector. Now, you don't need to use one of these. Most practitioners teach penile injections by putting the needle straight into the shaft. However, if I was in your shoes, I wouldn't be able to do it that way. So I think using an auto-injector is a game changer. You also need an alcohol swab. This is really important because you need to clean the top of the vial and also clean the shaft of your anatomy so you don't get any infection. And make sure you have a sharps container handy to dispose safely of the sharps. Before we dive into the actual injection technique, I know that getting the dosage and the technique right is the best way to avoid side effects altogether. So if you'd like professional guidance on finding your specific dose and polishing your technique, you can always book an online consultation with one of our practitioners. The link is in the description below. Now, before we move on to the actual injection process, let's take a closer look at your anatomy so you know exactly where we're working. First thing we do is look at Jeffrey. This is the glans or the head, and at the end of the head is what is often referred to as the eye, but it's actually the opening of the urethra, which is where the urine comes out and also the ejaculate when you have an orgasm. Then you have the shaft. There are two spongy tissues called the corpora cavernosa that go along the top. So imagine them like two cigars inside the tissue. That is the area that fills up with blood when you get an erection and gives you a nice firm result. On the underside of the shaft here is where the urethra goes. The best place to inject is the middle third. However, you can inject anywhere on the shaft, but not in the glans. So how do we draw up the injection medication? The medication is usually clear. However, I've dyed this one for demonstration purposes only. So the first thing you do is open an alcohol swab and you wipe the top of the vial. This is really important because you want to make sure it's clean and you don't want to get an infection. These vials are kept in the fridge and there's all sorts of goobies in fridges. Then you get your needle. Always use a clean needle for every injection. So you open up the needle, remove the orange cap, put it into the top of the bottle and turn it upside down. This bottle is self-healing, so when you take it out, no liquid comes out. Now you withdraw the plunger on the syringe and make sure you pull down so that the air and fluid comes into syringe. Then when you push the syringe back up to the dose you've been told by your practitioner. Now remove the needle, and as I say, the bottle shouldn't leak. Now you've got your syringe loaded and ready for action, get your auto-injector. Let me show you how this works. The button puts the needle into the shaft. Then you depress the plunger on the syringe to expel the medication. Hold the auto-injector like this. You hold the top and pull this lever up to click it backwards like so. Put the needle into the auto-injector and click it across. If you forget to click it across, when you press the button, nothing happens. So click it across and now it's loaded. Let me show you how this works without Jeffrey. When you press this button, the needle goes in. And yes, it looks like it goes in a really long way. Every time I show someone this, they say, "Is it going to go in that far?" But I really want to stress that the distance it goes in is really important because you need to get past the initial layer and into the corpora cavernosum, which are like those cigar tissues that we were talking about earlier. Also, you won't believe me, But there's not many nerve endings in this tissue, so the deeper the injection goes, the less you'll feel. No one ever believes me when I say this until they get their first injection, then they are amazed that it doesn't hurt. If you feel pain on injection, then most likely the medication has gone in the wrong area. This will not cause any long-term problems, however, you won't get an erection. Now everything is ready to go, so let's get to the exciting part. You now need to unveil your Jeffrey, which isn't going to be semi-rigid like this. It's going to be a whole lot floppier. You will get the best results if you stand to do the injection. So stand up and lean your bum against the wall or your bathroom cabinet. The reason for this is to stop you moving involuntarily when you inject. If you've got a foreskin, you need to retract it because you need to have the glands on show. With your dominant hand, hold the glands between your thumb and forefinger and then stretch it away from your body so it's out nice and straight with the foreskin pulled back. Now, locate the eye of your penis, your urethral opening. Make sure it's in the middle and draw an imaginary line down the middle of your shaft. Now place the auto-injector in the middle third, just to the right or just to the left of the midline. Make sure this circle is flat on the shaft. Please remember it's not a precise spot and don't worry about hitting blood vessels. The needle is very fine and it'll go straight through. You may get a small bruise, but it will resolve in a few days and not cause harm. Every time you inject, you alternate positions slightly to avoid scarring. Now you have everything in place. Hold firmly and press this button with your thumb. Then, with your finger, push the plunger down and remove the auto-injector and needle and place down. The needle will be protruding from the bottom of the auto-injector. Don't worry about that for now. Grab the base of the shaft like this and hold firmly for 60 seconds. A lot of my patients tell me they feel like they're strangling it, but that's what you need to do. You really need to compress at the base. The reason you do this is you want the medication to be absorbed inside both of those corporacavernosal tissues evenly, and it stops the drug from going whoosh back into your body. Remember, you are using a tiny dose, so if some gets pumped out with normal blood flow, it's not going to do much. Not all practitioners teach this technique, but I've found that it produces the most consistent results. Whilst you're holding the base, put a slight bit of pressure on the injection site to reduce any bruising. If you forget to do this, don't panic. That bit's not going to make a big difference. It's just going to look like you've got a little love bite on there. It's nothing to worry about at all. After you've been strangling the base for 60 seconds, let go. And now's the time you go and wake up your partner, start your foreplay, or go, ta-da, check this baby out. It's going to take about 10 to 15 minutes for you to get an erection, and it's going to look very natural and very normal. Now all the action's over, it's time to safely pack away your equipment. Put your medication back in the fridge where it needs to be kept. Make sure you dispose of your sharps safely. To remove the syringe from the auto-injector, hold the top here and pull it upwards. Then click back like so. Remove the syringe and place in the sharps container. If you don't have a sharps container at home, you can purchase them from pharmacies. If you live in Australia, you can return a full sharps container to your local pharmacy for safe disposal. If you live elsewhere in the world, I recommend asking the pharmacist what to do with your sharps container when it's full. Let's talk about safety. Our goal is for you to have an erection for 30 to 45 minutes. However, an erection that lasts longer than 2 hours is a problem because your anatomy isn't getting any fresh oxygenated blood, which may cause tissue damage. The technical term for this is priapism. An erection that lasts longer than 4 hours is a serious medical emergency and you must immediately attend the nearest emergency department. So if you still have an erection 2 hours after doing the injection, please go to my website in the patient portal and read the Priapism instructions, which are under the resources section. If you follow this procedure and the erection remains, contact your practitioner or go to the emergency department. I can't stress enough how important this is, not to just let an erection go on forever. Most men tell me they'd be really happy if they had one that lasted a long time. But trust me, you won't, because it actually becomes really painful and you can do some long-term damage. Understanding these safety protocols is a huge part of your clinical roadmap to recovery. If you're ready for professional one-on-one support to master these techniques or address your recovery, please book an online consultation at Restorative Health Clinic using the link in the description below. If you found this video helpful, I recommend you watch this one next to learn how to avoid a priapism or manage one if it happens to you.